Welcome to Capital Quality's webinar on formal and informal assessments. To provide ongoing support for the Capital Quality on-site administrators, the Office of the State Superintendent of Education, in partnership with Hurley and Associates, is implementing a series of community of practice for principals, center directors, and home care providers. This Community of Practice series is part of an ongoing effort to build capacity and knowledge as it relates to addressing the 10 quality indicators articulated in Capital Quality's Continuous Quality Improvement Plan. This webinar is an edited recording and presentation of the Community of Practice conducted on Friday, August 25th and Saturday, August 26th of 2017. This community of practice provided participants with a series of research-based practices and activities as it relates to developing formal and informal assessments. It also afforded participants an opportunity to meet and engage in team and relationship building activities with fellow Capital Quality participants and quality facilitators. This is one presentation in a series of community of practices designed to build the skills and competency level of providers participating in Capital Quality. This month's session, led by ICF, will provide Capital Quality community updates and an overview of formal and informal assessments. Additionally, it will provide an overview of upcoming professional development opportunities identified by Kids Comprehensive. Lastly, the community of practice includes an overview of upcoming community of practices and next steps for the Capital Quality community. July's community of practice consisted of 3 concurrent sessions focused on concept development, quality feedback, and language modeling as defined by the classroom assessment scoring system. Held across 2 locations, participants engaged in hands-on, meaningful activities focused on teacher-child interactions. Led by Capital Quality's quality facilitators, the sessions assisted participants in developing developmentally appropriate activities within each topic area and provided participants with a wealth of resources and materials in each session. Please watch July's Community of Practice for more information. It is available on the OSCE website. Over the last few months, the Capital Quality community has been working towards points of quality. You have accomplished a lot. Currently, providers are working on finalizing continuous quality improvement plans. Kudos to all sites that have completed 7 out of the 10 indicators. Incentives are currently being processed. All orders will be delivered directly to the provider sites from the vendor, Discount School Supply. Just a reminder, the initial CQI plans must be completed by Friday, September 29th. What is an assessment? According to NACE and the National Association of Early Childhood Specialists and State Departments of Education, an assessment is defined as a systematic procedure for obtaining information from observations, interviews, portfolios, projects, tests, and other sources that can be used to make judgments about children's characteristics. According to Capital Quality, the Continuous Quality Improvement Plan, an assessment is the process for gathering information about children in order to make decisions about their education. Assessments can reveal what children already know and how well they have learned what we want them to learn. For this to occur, assessments, learning objectives, and instructional strategies need to be closely aligned so they reinforce one another. Assessments can be divided into 2 distinct groups: formal assessments and informal assessments. Formal assessments are standardized assessments such as the ITERs, FICRs, or the class. Informal assessments are non-standardized tools such as observations, checklists, and portfolios. Both are used for obtaining information that can be used to make judgments about children's learning behavior and characteristics. Formal assessments include the collection of numerical data that can be analyzed across centers and classrooms. Informal assessments are a vehicle to provide anecdotal information on a teacher and on a child using non-standardized tools such as observations, checklists, and portfolios. Let's take a moment to practice conducting an informal assessment, an objective observation. Using a piece of paper and a pen, jot down your observations of the toddler as you watch the first 2 minutes of the video. Pause the presentation and watch. Okay, welcome back. What did you notice? What did you observe? What interactions did you notice about the child in the blue shirt? What can you note about his experience in the center? His feelings, disposition? What can you say, if anything, about the classroom organization or availability of materials? While watching the video, did you find yourself making comparisons of your own experiences? Or were you able to be objective and only jot down notes related to the toddler and his experiences? Child portfolios is another form of an informal assessment. A portfolio is a collection of evidence of the children's work over time. Sometimes called work samples, items are selected to document a child's growth over time. Child portfolios can be important when sharing information with families and other professionals. Do you use child portfolios in your centers, in your classrooms? How do you determine which work samples or items to include in the child's portfolios? Observations and child portfolios are both effective methods that can provide a more complete picture of a child's progress. The Basics of Assessment book, published by NACCE, is a great resource on formal and informal assessments. Visit pages 45 and 52 in particular for more information on child portfolios and observations. Think for a moment of some of the barriers and challenges in developing and implementing formal and informal assessments. Using a piece of paper and pen, pause the presentation and record your thoughts. Okay, welcome back. What did you come up with? You may have recorded the following barriers and challenges, especially as it relates to implementing informal assessments. Perhaps you thought of time. There just isn't enough time to develop quality tools. Maybe you don't feel like you have the knowledge or expertise in developmental milestones to develop appropriate checklists or observation tools. Or maybe you listed the lack of support or knowledge on how to use various assessments. And finally, you may have listed the lack of training or the fact that you need more training to implement such tools. The role of the quality facilitator you have been assigned is not just to provide a support in completing the CQI, but your quality facilitators are also tasked with assisting providers in developing and identifying tools and resources to assist you in implementing high-quality programs. Please work with your assigned facilitator to assist you in developing quality informal assessment tools and identifying quality formal assessment tools to help with your programs. Did we accomplish everything? Did we define formal and informal assessments? Did we communicate the importance of child assessments? And finally, did we provide an analysis of assessment processes? We would like your feedback. Ossie and Hurley & Associates are always eager to hear from you. As the inaugural year of Capital Quality has come to an end, we would like your feedback on our practices, strategies, and policies. Using paper and pen, please draft a response to the following questions. Once you have completed your responses, please craft an email and share your feedback with the OSSI Program Manager, Dr. Catherine Kagera. Question 1. What did you like about participating in capital quality? And question 2. What are the areas we can improve upon in the process? Community of practices are extremely important to us, and we would like to make sure they are beneficial to you. Using paper and pen, please draft a response to the following questions. Once completed, please craft it in an email and share your responses with the OSSI Program Manager, Dr. Catherine Kagera. Question 1. What would an ideal community of practice look like for you for the upcoming year? Question 2. What would you like to see in terms of professional development next year? And question 3. How can we improve upon our current community of practice model for the upcoming year for Group 3? Kids Comprehensive, the organization responsible for implementing the Child Care Resource and Referral System, publishes a quarterly catalog for providers outlining current professional development opportunities. The summer catalog is currently available. Please visit the CCR&R website or the OSSI website to download a copy of the most current catalog. Reminder: all providers must participate in training on the 12 indicators for health and safety by September 2017. All providers now have access to Quorum. Please visit Quorum for online trainings and professional development opportunities. Early Childhood Share DC is an online sharing platform for providers designed to help providers in sharing up-to-date knowledge and resources. Over 1,000 classroom and administration resources plus vendor discounts are currently available on the website. To access the site, please visit www.ecsharedc.org. Establish a profile, and a team member from the EC Share DC team will contact you to complete registration. You will need your center license number on hand. Quality facilitators will continue to support capital quality participants in completing the 10 elements included on the Continuous Quality Improvement Plan. Previous Community of Practice videos are currently available on the OSSI website, as well as other capital quality information. September's Community of Practice will focus on family engagement. We will also be celebrating our first year of capital quality. The event will be held September 29th and September 30th from 1 to 3 p.m. We are always available. Please follow us on Twitter and Facebook. Visit the OSSI website for up-to-date information. Also, please feel free to contact Dr. Catherine Kagera, Rashida Brown, or Pilla Parker for questions related to capital quality.